Hello, I'm Luke O'Neill and here I am in my lab in the Trinity Biomedical Sciences Institute. So this week I've just come off a huge conference on COVID-19. Lots of different countries, one at China, India, the US, and we were all discussing the latest developments in COVID-19. One very interesting thing is testing. So the Tokyo Olympics are happening next year in July. They're going to test every single person going into those Olympics to allow them in using the antigen test, a very sensitive test. The Chinese person said how all the big trade fairs are running now in China, and again everybody gets tested. So we're moving towards mass testing. This must come here eventually. The American person on the call spoke about a brand new test for viable virus. In other words, you can detect now a living virus in someone's body. That's a much better way to detect if someone is infectious, because the live virus might spread to someone else. This may well replace the PCR test, and that'll be tremendous. We now know who's infectious and who isn't. In the next 3 to 6 months, we can see all these new tests and these strategies being rolled out. And again, just this week, a study about asthma. Now we know certain diseases put you at a higher risk of COVID-19. For example, heart disease, diabetes. Interestingly, asthma might protect you. And that was a bit surprising because asthma damages your lungs and then you might be having an infection in your lungs and there could be a double whammy there. But no, asthma seems to decrease the risk of COVID-19. There's 2 possible reasons. One is if you're asthmatic, you have less ACE2 in your lungs. Now ACE2 is the lock that the spike goes into to open up to get inside your lung cells, so therefore less ACE2 might mean you're getting less infections, I suppose. But secondly, asthmatics are protecting themselves more. They're wearing masks more, inhaling less irritants for their lungs maybe. So it's good news for asthmatics. It actually lowers your risk of getting COVID-19. So you can hear about these and other stories on my weekly update on COVID-19 with Pat Kenny on Newstalk.